If you're over 60 and waking up tired every single morning, even after a full night's sleep, you are not alone, and it is not just part of getting old. In this video, I break down the 7 most common medical and biological reasons why seniors wake up exhausted, and more importantly, what you can actually do about each one. We cover everything from how your sleep architecture changes with age and why you lose deep, restorative sleep, to overlooked conditions like sleep apnea, restless leg syndrome, thyroid disorders, anemia, and medication side effects that silently steal your rest night after night. Whether you are experiencing this yourself or trying to help a parent or loved one, this video will give you a clear, evidence-based picture of what is happening and a starting point for real solutions. But real quick before we dive in, if you're new here, welcome. This channel is all about giving you honest, practical health information that actually helps you make better decisions for yourself and your family. We are on a mission to reach 1,000 subscribers, and every single person who joins this community genuinely matters to us. So if you find today's video helpful, please hit that subscribe button and ring the notification bell. It costs you nothing, and it means the absolute world to us. Okay, now let's really get into it. You go to bed at a reasonable hour. You sleep for 7, maybe 8 hours. And when the alarm goes off, or your body wakes you up at 5 in the morning, you don't feel rested. You feel tired. Sometimes just as tired as when you went to bed the night before. If that sounds familiar, I want you to hear something important before we get started. This is not just you getting older. This is not normal aging that you simply have to accept. There are real, specific, treatable reasons why so many seniors wake up exhausted every single morning, and most of them are being missed. I'm Dr. Eric George, and in this video, I'm going to walk you through the 7 most common medical and biological reasons why seniors wake up feeling exhausted, what is actually happening in your body, and what you can do about it. We're going to cover things ranging from deep changes in your sleep biology as you age, to conditions like sleep apnea, restless leg syndrome, nocturia, thyroid problems, anemia, and medications that quietly destroy your sleep, often without you ever realizing it. By the end of this video, you'll have a clear framework for understanding your own fatigue and a real starting point for conversations with your doctor. Let's start with what's actually happening in your brain while you sleep, because this is the foundation of everything else. The biology of sleep and aging. To understand why you wake up tired, we have to talk about sleep architecture, which is essentially the internal structure of your sleep night. Healthy sleep is not a single flat state. It's a cycle. You move through 4 stages repeatedly throughout the night. Light sleep, deeper sleep, what we call slow wave sleep or deep sleep, and REM, rapid eye movement sleep, where most of your dreaming and memory consolidation happens. Each full cycle takes roughly 90 minutes, and you repeat it 4 to 6 times in a night. Here is the problem for seniors. The aging process fundamentally changes this architecture. Beginning in middle age and accelerating after 60, the brain progressively loses the ability to generate slow wave sleep, deep sleep. Research from the National Library of Medicine confirms that there is a dramatic, progressive decrease in the deepest stage of non-REM sleep as we age. In some seniors, it nearly disappears entirely. Why does this matter? Because deep sleep is the most physically restorative stage of your night. It's when your body repairs tissue, consolidates memories, regulates hormones, and does the cellular maintenance that keeps you functional the next day. When you lose deep sleep, you spend more time in lighter stages, and you wake up more easily. Research shows older adults wake an average of 3 to 4 times per night, and they're more aware of being awake when it happens. The transitions in and out of sleep become more abrupt, so even brief awakenings register as real disruptions. The result? You technically sleep 8 hours, but the quality of that 8 hours is fundamentally different from what it was at 35, and your body feels that difference. Cause number 1, sleep architecture breakdown, lower third. Cause number 1, loss of restorative deep sleep. We just covered the biology, so let me be specific about what this looks and feels like for you day to day. If you wake up in the morning and feel physically unrefreshed, not just a little groggy, but genuinely like your body hasn't recovered, this is the most likely first explanation. You haven't gotten enough deep sleep to do the cellular repair work your body needed overnight. Other signs that deep sleep loss may be your primary issue include waking frequently during the night with no obvious cause, feeling like your sleep is very light or easily disturbed by sounds you would have slept through years ago, and taking longer to recover physically from exercise or activity. Now, the uncomfortable truth is that some degree of this is a natural consequence of aging. But there's a wide spectrum between some reduction in deep sleep and almost none at all. And where you fall on that spectrum is influenced heavily by the other factors we're about to cover. Treating sleep apnea, managing pain that fragments sleep, optimizing your circadian rhythm. All of these things help preserve what deep sleep you have left. So if this is your primary issue, the answer isn't to accept it. The answer is to make sure nothing else is making it worse. Let's talk about the biggest culprit. Cause number 2. Sleep apnea lower third. Cause number 2. Obstructive sleep apnea. Sleep apnea may be the single most underdiagnosed cause of morning exhaustion in seniors. And I want to spend real time here because so many people watching this video almost certainly have it and don't know it. Here's what happens. As you age, the muscles in your neck and airway naturally weaken. During sleep, when your body is relaxed, these weakened muscles can collapse inward, partially or fully blocking your airway. Your brain detects the drop in oxygen, triggers a brief awakening to reopen the airway, and you resume breathing. This cycle can happen anywhere from 5 to 30, 50, even 100 times per hour. Most people with sleep apnea never consciously remember waking up. They have no idea it's happening. But the consequences are severe. Every time that cycle happens, you're being pulled out of deeper sleep. You're not getting the restorative stages. You're waking up with blood pressure elevated, cortisol elevated, and oxygen-depleted blood having circulated through your body all night. Research confirms that older adults are at significantly higher risk for sleep apnea than younger adults. The combination of muscle weakening and age-related weight redistribution, particularly around the neck, makes the airway more vulnerable. The classic signs of sleep apnea include loud snoring, particularly with gasping or choking sounds, waking with a dry mouth or sore throat, morning headaches, feeling completely unrested regardless of how long you sleep, needing to get up to urinate 2 or more times per night. A condition called nocturia, which we'll cover in a moment, can also be a sign of sleep apnea. A bed partner reporting pauses in your breathing. The good news is that sleep apnea is highly treatable. CPAP therapy, which delivers gentle, continuous air pressure to keep the airway open, is the gold standard, and most patients who use it correctly report dramatic improvements in morning energy within weeks. If you haven't been evaluated for sleep apnea, this is the first conversation to have with your doctor. A sleep study, which can now often be done at home, is all that's needed for a diagnosis. Cause number 3. Your circadian clock is shifting lower. Third cause number 3. Circadian rhythm phase advance. Your body runs on an internal 24-hour clock, called the circadian rhythm, controlled by a tiny region of your brain called the suprachiasmatic nucleus, or SCN. This clock governs when you feel sleepy, when you feel alert, when your body releases hormones, even when your core temperature rises and falls. With aging, this internal clock shifts forward in time. The scientific term is phase advance. What it means practically is that your body starts pushing your natural sleep window earlier and earlier. You feel genuinely sleepy at 8 or 9 in the evening, and your body naturally wakes up at 4 or 5 in the morning, whether you want it to or not. Research from the Sleep Foundation confirms that deterioration of SCN function with age directly disrupts circadian rhythms, affecting when older adults feel tired and alert. Part of this is also caused by reduced light exposure. Many seniors, particularly those who are less mobile or living indoors, average only about 1 hour of daylight per day. Light is the most powerful signal for keeping your circadian clock properly set. Here's why this causes morning exhaustion. When your circadian clock is shifted significantly earlier, your sleep pressure, the biological drive that keeps you asleep, begins releasing earlier in the night. By 4 or 5 in the morning, your brain is signaling that it's time to be awake. If your lifestyle requires you to be up at 7, you're waking after only 5 or 6 hours of quality sleep, even if you went to bed at 9. The practical solutions for circadian disruption include consistent morning light exposure, ideally sunlight, within 30 to 60 minutes of waking, even on a brief walk outside. Avoiding bright artificial light, particularly blue-spectrum phone and screen light, in the 2 hours before bed. Maintaining a fixed sleep and wake time 7 days a week, regardless of how you feel. Low-dose melatonin taken about 2 hours before your desired bedtime. Discuss with your doctor, as timing matters more than dose. Cause number 4. Restless leg syndrome lower third. Cause number 4. Restless leg syndrome, RLS. Restless leg syndrome, RLS, is a neurological condition that creates an almost irresistible urge to move the legs, almost always in the evening or at night when you're trying to rest. It's typically accompanied by deeply unpleasant sensations in the legs, crawling, aching, tingling, or itching feelings that only temporarily improve when you move. This condition is more common than most people realize. Over 3 million Americans are diagnosed with RLS each year, and the condition is more prevalent in older adults and in women. Many seniors have been experiencing this for years without ever knowing it had a name or a treatment. For sleep purposes, RLS is devastating. It makes it very difficult to fall asleep, and when it occurs during the night, which it often does, it pulls you into lighter sleep or wakes you entirely. People with severe RLS can get fewer than 5 hours of sleep per night, even when they're in bed for 8 or 9. RLS is also strongly linked to iron deficiency. A simple blood test can check your ferritin levels, as well as kidney disease, diabetes, and in many cases, sleep apnea. Treating the underlying condition often substantially improves RLS symptoms. Things that help manage RLS. Iron supplementation, if deficiency is confirmed by blood work. Reducing or eliminating caffeine and alcohol, which worsen symptoms. Regular daily exercise, though not too close to bedtime. Warm baths or leg massages before bed. In more severe cases, prescription medications are available. Discuss with your neurologist or sleep physician. If you recognize these symptoms, bring them up specifically with your doctor. RLS is frequently overlooked during standard visits because patients don't always know how to describe it or don't realize it's medically significant. Cause number 5, nocturia, the bathroom problem, lower third. Cause number 5, nocturia, nighttime urination. Nocturia, needing to get up to urinate 1 or more times during the night, is one of the most common and most disruptive sleep problems in older adults, and it rarely gets the medical attention it deserves. For many seniors, this feels like a normal part of aging. Oh, I always get up 2 or 3 times a night. But here's what's important to understand. Each of those awakenings takes you out of whatever sleep stage you were in, and getting back into deep sleep after waking takes time, often 20 to 30 minutes. If you're up 3 times a night, you've lost a significant portion of your restorative sleep, night after night. And here's something that surprises many patients. Nocturia is sometimes a symptom of sleep apnea, not just a bladder or prostate issue. When breathing stops repeatedly during sleep, it creates pressure changes in the chest that the kidneys interpret as a signal to produce more urine. Studies have shown that treating sleep apnea with CPAP dramatically reduces nocturia events in many patients. Common treatable causes of nocturia include untreated sleep apnea, enlarged prostate, BPH, in men, bladder overactivity in women, poorly controlled diabetes, excess glucose in the blood pulls water through the kidneys, certain medications, particularly diuretics. If these are taken in the evening, ask your doctor about timing adjustment. Heart failure, fluid that accumulates in the legs during the day redistributes when you lie flat, increasing kidney filtration at night. If you're getting up more than once per night consistently, tell your doctor. This is not something you simply have to live with. Cause number 6, medications lower third. Cause number 6, medication effects on sleep. The average senior takes between 4 and 5 prescription medications. Many of these have effects on sleep that are not prominently listed on the label, and some of the most common medications prescribed to older adults are among the worst offenders for sleep disruption. Let me be clear. I am not telling anyone to stop their medications. That conversation must happen with your physician. But I want you to be aware of the categories of medications that commonly affect sleep, so you can have an informed conversation. Medications frequently associated with sleep disruption in seniors. Beta blockers, used for heart disease and blood pressure, can suppress melatonin secretion, making it harder to fall and stay asleep. Diuretics, water pills, increase nocturia, especially if taken in the late afternoon or evening. Certain antidepressants, some are sedating and cause excessive morning grogginess, others are activating and cause insomnia. Corticosteroids, like prednisone, strongly disrupt sleep architecture when taken at certain times. Some antihistamines cause next-day sedation, the hangover effect, especially in older adults who metabolize drugs more slowly. Decongestants, stimulant effects can prevent falling or staying asleep. Seniors metabolize medications differently than younger adults. A dose that's appropriate for a 45-year-old may linger far longer in a 70-year-old's system, causing effects that feel disconnected from the medication because they emerge hours later. Bring your complete medication list, including over-the-counter medications and supplements, to your doctor and ask specifically, could any of these be affecting the quality of my sleep? Cause number 7. Hidden medical conditions, lower third. Cause number 7. Underlying medical conditions. The final category is perhaps the broadest and the most important to not overlook. Underlying medical conditions that cause fatigue or disrupt sleep, and that may not yet be diagnosed or adequately treated. Hypothyroidism. An underactive thyroid is one of the most common and most frequently missed causes of persistent fatigue in older adults, particularly women. The thyroid is responsible for regulating your metabolic rate. When it underperforms, virtually every system in your body slows down. You feel heavy, cold, mentally foggy, and profoundly tired regardless of how much you sleep. A simple blood test, TSH and free T4, can diagnose this. And thyroid medication is very effective at restoring energy levels when prescribed appropriately. Anemia. Anemia, insufficient red blood cells to carry oxygen effectively, is common in older adults and causes fatigue that is often described as bone-deep exhaustion. Morning tiredness is particularly notable because the body has been essentially oxygen-limited for 8 hours. Iron deficiency anemia, B12 deficiency anemia, and the anemia of chronic disease are all common in seniors. Again, a simple blood count and metabolic panel can screen for this. Depression. Depression in older adults is frequently underdiagnosed because it often presents differently than in younger people. Rather than overt sadness, seniors with depression more commonly experience fatigue, loss of interest in activities, cognitive slowing, and changes in appetite. Sleep disturbance, particularly early morning awakening with inability to return to sleep, is one of the hallmark symptoms. Depression is both medically real and highly treatable. If you consistently wake in the early morning hours with racing thoughts, low mood, or a sense of dread about the day, please bring this up with your doctor. Other conditions to discuss with your doctor: heart failure, overnight fluid redistribution, reduced cardiac output, and disrupted breathing patterns all contribute to poor sleep. Chronic pain from arthritis, neuropathy, or other conditions. Pain in the small hours of the morning is a major and often unaddressed sleep disruptor. Diabetes with poorly controlled blood sugar, nocturnal hypoglycemia or hyperglycemia both fragment sleep. Kidney disease, uremic fatigue, and secondary restless leg syndrome. What to do? Practical steps and when to see your doctor. Lower third, your action plan. Let me pull this all together into a practical framework. Step 1. Track your symptoms for 2 weeks before your doctor's appointment. Note what time you go to bed, how long it takes to fall asleep, how many times you wake, whether you need to urinate, what you feel like in the morning, and your energy level by midday. This data is invaluable. Step 2. Tell your doctor specifically what you are experiencing. Don't just say, "I'm tired." Say, "I sleep 7 hours and wake up feeling completely unrested. I wake 2 or 3 times a night to use the bathroom. My legs sometimes feel restless at night. My energy is low by 10 in the morning." Specificity leads to better evaluation. Step 3. Ask for these basic investigations if you haven't had them recently. Complete blood count, screens for anemia. Thyroid function, TSH at minimum. Blood glucose and HbA1c, screens for diabetes. Basic metabolic panel, kidney function. Ferritin, iron stores, especially relevant if RLS symptoms are present. Step 4. Ask about a sleep study if you snore, gasp, or wake unrefreshed, regardless of hours slept. Home sleep studies are now widely available and are far more comfortable than in-lab testing. There is no reason to go undiagnosed for sleep apnea. Step 5. Address the modifiable factors right now. Get morning sunlight within 30 to 60 minutes of waking. Establish a consistent wake time 7 days a week. This is the single most powerful circadian anchor. Reduce screen exposure in the final 90 minutes before bed. Review your medication timing with your pharmacist or physician. Limit caffeine after noon and alcohol entirely near bedtime. If pain is waking you, ask your doctor about optimizing your pain management regimen. To summarize, if you are a senior waking up tired every morning, there are 7 major categories to investigate, and most of them are treatable. Number 1. Loss of deep sleep with aging. Number 2. Sleep apnea. Number 3. circadian rhythm phase advance. Number 4, restless leg syndrome. Number 5, nocturia. Number 6, medication effects. Number 7, underlying conditions like hypothyroidism, anemia, or depression. You don't have to accept exhaustion as your baseline. Most people who investigate these causes and treat what they find experience meaningful, real improvements in how they feel every morning. If this video was helpful to you, please like it and share it with someone you care about. There are a lot of seniors out there suffering through tired mornings who don't know this information is available. Subscribe for more evidence-based health content every week. I'll see you in the next one.